Welcome to Mayo Clinic Behind the Scenes in Surgical Services, a podcast for surgical healthcare staff. I am your host, Lynn Sari, Nursing Education Specialist Manager in Surgical Services at Mayo Clinic based out of Rochester, Minnesota. Mayo Clinic Behind the Scenes in Surgical Services podcast focuses on collaboration, innovation, and inclusivity within surgical services at Mayo Clinic.
Thank you, Lynn, for that introduction. Today, we are joined by Amy Claudic, Heather Nelson, and Victoria Northrup, all of which are Mayo Clinic Certified Surgical Technicians, commonly referred to as CSTs. Our episode today focuses on a day in the life of a CST. So thank you all for being here today. I would like each of you to just introduce yourselves and where you're working now. Amy, if you would like to start.
Sure. My name's Amy Claudic. I've been a CST for 15 years now. My last 13 years have been with Mayo, and I work in the Department of General Colorectal and Transplant, primarily in colorectal surgery.
Great. Thank you for being here, Amy. Heather, would you like to go next?
Hi, I'm Heather Nelson. I am a CST on Gone to 15. I am in sports medicine and hands and feet.
All right. And Victoria, can you introduce yourself, please?
Hello, I'm Victoria Northrup. I am a CST here at Mayo Clinic. I've been here the last 2 years working in neurosurgery.
Great. Well, we appreciate you all being here, and you all have different breadths of knowledge. So we're just going to get started with a couple questions. Amy, can you tell me a little bit about your job role as a CST?
As a CST, we work in the operating room. We are in charge of the sterile technique and making sure everyone remains sterile during a surgery. We are the person who sets up all the instruments in the OR, and we drape out the patient. And we are the hands that hand the instruments to the surgeons. So we're right there giving them what they need during the cases.
And Heather, can you explain to me a little bit what the educational background entails to become a CST?
It is a 2-year program. I know I've heard some people that have done their generals and then it's like a 1-year. I went through the 2-year program. So the Associates of Applied Science and Surgical Technology.
Victoria, what did your schooling look like? Was it similar to Heather's experience?
I went through a similar program. I did a 2-year degree. The first year consisted of more general classes that you would typically see, like introductory biology, introductory chemistry, that sort of thing. And then our second year was more focused on surgical technology and doing our clinical rotations. And then I did my clinical rotations here at Mayo. So we did 500 hours of scrub time here at Mayo Clinic, and we were able to get over 120 cases done as a requirement to graduate. And then after that, we had to take our certification exam and pass that to become qualified to work as a CST.
That sounds like a lot of education you guys have received for this role. Amy, did you have a similar experience for your educational background?
I did. I also did the 2-year program, first year of generals and the second year of more surgical classes and clinicals. Also did my clinicals here at Mayo Clinic, and same thing, graduated with an Associate of Applied Science degree, and then went ahead with the certification exam after that.
So Victoria, what continuing education is required to maintain your certification?
To maintain our certification, we have to recertify every 2 years through the Association of Surgical Technology, and that usually requires 30 continuing education credits every 2 years that have to be submitted to AST to recertify us for the next 2 years.
So now we're going to look at, can you tell me what drew you to this career? Would you like to start, Heather?
I actually wanted to do an OR nurse. And I got accepted and went in and did the first couple months. And I just found out that it was not really for me because I wanted to be really hands-on in the surgery and doing a circulator. I give them props. They have a hard job to run around and collect everything that we need when we're scrubbed in. I love doing the hands-on, being able to pass those instruments. It's awesome. Being able to be in something that's great and helping somebody out. That's what really drew me to it.
How about you, Amy? What drew you to this profession?
Growing up, I used to watch a show on TV, Trauma, Life in the ER, and I was very drawn to kind of the gore of it a little bit. But I was in a medical explorers program in high school and thought I wanted to work in the OR or in the ER, and we went to a smaller town hospital and it was pretty boring. The ER there, it was earaches, stomach hurts. And my sister was at the time looking into college degrees and stuff. And my mom came home from a job fair with her and brought home a brochure for me on surgical technology. And I kind of started looking into it more. And when I realized it was a 2-year degree and 50 minutes from home, I just kind of kept looking into it. And I haven't looked back after 15 years. I still love what I do.
Well, that's very fortunate that your mom brought home that brochure for
Yeah.
you. And Victoria, how about you? What brought you to this career path?
So I always knew I wanted to be in the medical field. I just didn't really know what I wanted to do. I didn't feel like nursing was really my calling. And even though I went and got my bachelor's degree, I didn't really want to continue on to medical school or anything like that. It just wasn't what I wanted to do. And I actually randomly found surgical technology when I was just looking through jobs that you can do in the medical field that maybe I wasn't even aware of. And I saw that the local community college had a program for it. And so I said, why not? And I stand by that decision because, again, I love what I do, being in the surgery, being part of just some really fantastic teamwork that happens and really doing something amazing to help these patients. It's, a job that I never even knew existed until I randomly saw it on a listing somewhere. And, I'm so happy that I found it because I really do love this job.
Well, I don't know how anyone wouldn't like to be a CST with your guys' experiences. So, moving on, what is the most rewarding part of your job? Amy, would you like to start?
I love just getting in a rhythm with the surgeons. Every case is different, every patient is different. And just that handing them the instrument before they ask for it, before troubleshooting what they need, they may be struggling with something and you've saw something in another surgery and you mention it. And then also working at Mayo Clinic, seeing patients who were told they were inoperable or you're kind of their last hope, and to be able to be a part of that for them and to hear how they come out from the surgery is always very rewarding, to just know that you are standing alongside some of the world's best surgeons and you're the one that's handing the instruments in their hands. It's just really awesome.
Heather, what about you? What do you find most rewarding?
I definitely agree with Amy. Being able to hand those instruments before they ask for it, and then they kind of just look back at you and give you that little wink, and it's so great. It's awesome. I love my job.
And Victoria, what about you? What's the most rewarding from your perspective?
I just love being a part of a cohesive team because we have some amazing surgeons here. We have some amazing nursing staff, even from our neuromonitoring colleagues, our anesthesia colleagues. We just have so many great people, and coming together to work as a team to really change a person's life is something that I can find satisfaction in my job, knowing that we helped a patient today and we did the best that we could because we have some of the best on our team here.
So, someone who might want to come into this career field, they might be thinking, what does a typical day look like? Or what does the beginning of the day look like? Can you explain that, Victoria?
Sure. So I'll figure out where I'm assigned for the day, what OR I'm going to be in, which surgeon I'm going to be working with that day, see what the surgical listing is, just so then I have an idea of what I need to set up and what I need to prepare for that day. And after our morning report, where our entire department gets together and any announcements are made at that time, I'll then go to my OR and start setting up the case, going through our case carts, looking and seeing what supplies I have, what I might need to go grab, and making sure that I'm ready to start the case with all of my supplies. At that point, once I've verified everything, I'll usually then start setting up the sterile field, scrub in, and start setting up my instrumentation that I'll need for the case. Usually with the help of the circulating nurse or maybe the surgical assistant, they'll help open things to me onto the sterile field. Once I have that set up, at that point, I will usually, if I have time, help the nurse with whatever they might need, whether it's helping position the patient when they come into the room, positioning them for surgery, or just grabbing odds and ends that we might need for the case. And that's usually the first 30 minutes of my day. In neurosurgery, we kind of move a little bit more slowly during the mornings. So there's a lot to set up for those cases. So that's usually what I spend the majority of my morning doing.
Amy, would you say, would there anything be different in your area when you start your day?
No, we kind of have the same thing. Our whole department has a little morning report, and then yeah, you just find what OR you're assigned to. I like to kind of look up or have the nurse help me look up the patient's history. In colorectal, we deal with a couple different types of disease processes, and it always helps me figure out what I need for the case if I get a wrong pan of instruments or not.
Mhm.
But yeah, it's fairly similar to you kind of just go through your supplies, make sure you have everything, and then scrub in and start setting up all your sterile stuff and just get ready for the procedure.
Great. And Heather, working on Gonda 15, I think you could have a little different workflow in the morning. What else can you do besides being a CST in the OR during your workday?
So here on Gonda 15, we actually can work in decontam, which is washing our instruments, getting them ready to be sterilized and or counted and then sterilized. And then we also work in the core where we actually sterilize our instruments. The first 30 minutes or so of getting started in the day, I always like to do my first scrub, get that done and out of the way. That way, as soon as we're done with report, I can go into the OR if I'm in the OR. If I'm in decontam or in the core, I can go around and start helping open to the sterile field for the tech that's in that OR. Just miscellaneous things like that.
And do you find it beneficial to be able to be in both the OR and the core?
Yes, I like it. It kind of helps switch up the day a little bit. You learn your pans. That's a big thing that I like being in the core because then I can tell the nurse if something's missing in there. She can just write it down quick. And then when it gets into the core, they can put the instrument that was missing in the pan.
Great, thank you. So, what advice would you guys give to someone who might be interested in this career path? Victoria, would you like to start?
Sure. My biggest piece of advice would probably be to just be very flexible because just inherently in the OR, there's a lot of stuff that can happen that might be unexpected or you didn't plan for or the surgeon didn't plan for. And so you have to be very flexible and willing to quickly change your plan. You know, you think you know what's going to be happening, but maybe something occurs, then all of a sudden you have to change your plan. And I think all of us have to have a very flexible attitude for anything unexpected that might pop up.
Very true. Amy, what about you?
I guess I would give advice to someone looking into the field of surgical technology. Just ask around. There's so many people I've ran into that do the same job that I do that I had no idea. And to stick through the program, clinicals are fun. You get to see a wide variety of surgeries. And that's one thing that's amazing with our job is if you don't like one area, there's many other specialties that you can go and work in. And you're always learning. It's never mundane. You're always, like she said, things are always changing. You have to be flexible and you're every day, you're always learning something. It never gets boring.
Great. And how about for you, Heather?
If I would ask to see if you could possibly shadow a tech if you're really interested in it, you could get the inside and see kind of if you even like being in the OR, if that's, if it's your thing, it's pretty sweet.
Thank you. So, kind of in summary, can you each highlight what you want the listeners to take away from this episode today? Would you like to start, Amy?
Being a CST is very rewarding. Like I said, we work with some of the most amazing surgeons in the world. We see some people at their worst, and some patients recur back day after day for multiple surgeries. And it's just rewarding to see how they progress. And knowing that you are such a vital role in the OR, handing those instruments, the surgery wouldn't happen without you. And if it did, it would be a lot slower. And then I also think a big thing for me is it's okay to have a 2-year degree. I have never once thought of furthering my education and getting a 4-year degree or whatever. The 2-year program for a CST is great. And you can make decent money with it. And I don't know if people feel ashamed of only having a 2-year degree or not, but I'm not, and I love it. It's a very awesome and rewarding job to have.
That's great. How about you, Victoria? What would you like to highlight for the listeners?
I think I would say this is such a rewarding job. I know we've mentioned that quite a few times, but there's just so many amazing opportunities, like all of the different surgeries you get to participate in, the skills that you get to learn, the people that you meet, the people that you get to work with, the patients that you help. There's just so many things that I didn't really expect when I was coming into this job, and how rewarding it would be at the end of the day to say I was an essential part of what happened today and in changing this patient's life. Like I said before, I didn't even know this job existed until I randomly found it. And I think it's a wonderful opportunity for people who maybe want to enter into the medical career, but they don't maybe know how they want to go about doing that. This is a wonderful option.
Thank you for those insights. And Heather, what about you? What would you like people to take away from this?
Techs don't just pass instruments. You're pretty much like the backbone to that surgery. You're setting up, you are in it, and you help clean up. It's great.
It seems like you all really enjoy your job, so that's always a great thing to hear. And you have brought some really great perspectives for all the listeners. I just really want to thank you, Amy, Heather, and Victoria, for your time and insights into a day in the life of a CST on this episode of Mayo Clinic Behind the Scenes in Surgical Services.
Thank you for joining us for this episode of Mayo Clinic Behind the Scenes in Surgical Services. I hope you enjoyed learning more about this topic. We invite you to check back often for our latest podcast on the Mayo Clinic YouTube channel by searching Behind the Scenes in Surgical Services podcast. Please share your thoughts, questions, or suggestions via email at dlrstsspodcast@mayo.edu and reference this episode. Until next time, have a great day.